I am originally from Ghana with a background in cardiac surgery. I'm currently practicing at Beth Israel Deaconess Medical Center, which is part of the Harvard Medical School. I got involved in digital health about 5 years ago with an aim of trying to democratize access and delivery of cardiovascular care in Africa. Digital health has enabled me to help increase access of wearable technology, software platforms with AI embedded technology to areas of Africa where traditionally healthcare has not been available. Remote care and remote monitoring can democratize access and delivery of healthcare in remote parts of the world, especially in places like Africa. As we've realized with the pandemic, many people are not able to access hospital care because of the coronavirus situation. Telemedicine and remote monitoring provides an opportunity for patients and populations to receive medical care, healthcare advice remotely from the comforts of their home. So we have different solutions that are currently available in the cardiovascular space. We have app-based solutions, we have connected devices, and we have platform technologies. So an example of a platform technology used for hypertension is the MedLabs platform from Medtronic. Uh, an example of a connected device platform would be an e-device solution from eDevice, and app-based solutions with embedded artificial intelligence technologies like HealthGauge are pioneering some of those app-based approaches. Interoperability is key for individuals to have access to their own healthcare data and enable individuals to share their healthcare data with providers, insurers. And to do that, we need international standards like HL7 and FHIR that allow the data between IT applications to be shared amongst clinical databases. So that would be the key for individuals to be able to own their data and share their data. There are a number of human machine interactions and human machine collaborations in the healthcare space. In cardiology, we can currently use artificial intelligence with embedded devices to detect abnormal heart rhythm. AliveCore is one of those companies doing work in this space. In the ophthalmology space, Google is using artificial intelligence to detect abnormal eye scans in diabetic patients in India. In the radiology space, we are beginning to see advanced neural networks help radiologists make diagnoses on x-rays at a much faster pace than a clinician will do. Such technologies, when well harnessed, promise to transform healthcare in emerging and developing countries where we know there are not enough specialists in the cardiology, ophthalmology, and radiology space. There are a number of solutions that are required to be in place for remote care and remote monitoring to be readily available in emerging countries. We need to have widespread connectivity in remote parts of many of those emerging countries. The network has to be widespread, it has to be cheap, and most likely we will need at least 4G, 4G LTE, and 5G networks. Secondly, we will need to have low-cost devices with Bluetooth connectivity. Number three, we will need to have security and privacy and regulatory issues addressed. Number four, we will need to have mobile networks that are readily available, as well as data plans that are readily available for most of the citizens of those countries. Number five, we would also need to have the ability to do telemedicine and teleconsultation with secondary opinions with leading specialists, perhaps not in those emerging countries, but in the first world countries, to enable cross-border care to be successful. There are a number of technologies to keep patients' data safe. One of the latest technology being employed is blockchain technology. Blockchain technology uses encryption methodology to help keep patients' data safe and private. Some of the security concerns can be addressed using blockchain technology. There are a number of other safety technology platforms that use a number of authentication software to help keep patients' data safe and secure. I believe that more attention needs to be placed in keeping patients' data safe and secure in order for patients to be more comfortable with owning their healthcare data. Such technologies can also enable patients to share their data for research in an anonymized fashion, and can also be monetized also for from the patient's point of view. Those are all technologies that are being developed currently in the research or early pilot phase, and hopefully such technologies will give patients more confidence in securing their data. The future for remote care in emerging countries will require a number of things to happen. Number one, we need to have widespread internet access in most parts of those developing countries, preferably 4G or 5G networks. Number two, we need to have regulation around telemedicine use across borders. Number three, we will need to have low-cost devices, preferably with Bluetooth connectivity. Number four, we will need to have mobile money payments such that individuals can pay for those telemedicine consultations, preferably with some insurance availability. Number five, we will need to have security and privacy addressed, especially when it comes to healthcare ownership of data. I believe some of these, when addressed, will enhance telemedicine and remote monitoring adoption in most of these emerging countries.